If you're thinking about retiring in your 50s or your early 60s, there is one expense that can make or break your entire retirement plan: healthcare. For Americans, this is the elephant in the room, and in 2026, that elephant just got a whole lot bigger. Today, I want to do three things. One, walk through exactly how the Affordable Care Act health insurance works with real dollar amounts. Two, explain what changed on January 1, 2026, and why it matters so much for anyone retiring before 65. And three, lay out every realistic option you have right now, including a few most people don't consider. No politics here, no fear tactics, just math, facts, and planning clarity. Hi, I'm Elle, and welcome to the channel. First, what ACA subsidies are and why they matter. Let's start with the basics so you'll understand exactly how the system works before we talk about what changed. ACA, or the Affordable Care Act, also called Obamacare, created health insurance marketplaces where individuals can buy coverage, and it created subsidies, formerly called premium tax credits, that lower your monthly health insurance premiums, sometimes dramatically. But here are the rules that affect everything. First, these subsidies are only available if you buy coverage through the ACA marketplace. That's healthcare.gov or your state's exchange. You can't get them through a private broker or an off-marketplace plan. Second, and this is the part that changes everything for retirees, the subsidies are income-based, not asset-based. This is a critical fact. Your net worth is not a factor. Your 401k balance is not a factor. Whether you own your home outright is not a factor. Whether you have $2 million invested is not a factor. ACA eligibility is based on one thing: your household modified adjusted gross income, your MAGI for short, compared to the federal poverty level, and that's it. This means you could be a millionaire on paper and still qualify for significant help with your health insurance premiums as long as your reportable income falls within the right range. And that is why the ACA is such a powerful tool for early retirees. Because retirees, unlike people still working a W-2 job, often have control over how much income they legitimately report in any given year. We're going to come back to that because it's the key to everything. Now let's translate this into actual numbers. The federal poverty level, or FPL for short, is a number set by the government each year based on household size. For 2026, here's what it looks like. For a single-person household, the poverty level is approximately $15,060. From there, the income bands scale up. At 200% of FPL, that's about $30,120. At 300%, roughly $45,180. And at 400% of FPL, and remember this number because it's about to become very important in our discussion, that's approximately $60,240 for a single person. Now, for a two-person household, a married couple, the baseline is approximately $20,440. At 200%, that's about $40,880. At 300% of FPL, roughly $61,320. And at 400% of FPL, that's approximately $81,760 for a couple. This is why household size matters. A married couple has significantly more room to work with than a single person. Those income bands are actually quite generous, and they give couples real flexibility to manage their income and still qualify for substantial help. Keep those 400% numbers in your mind: $60,240 for a single person and $81,760 for a couple, because what happens at that line is the entire story for 2026. How the subsidies worked through 2025. Now, to understand what changed, you first need to understand how the system worked from 2021 through 2025 because it worked really well for early retirees during that brief period. Under the enhanced rules created by the American Rescue Plan in 2021 and extended through the end of 2025, there was a built-in cap on what you were expected to pay. Your health insurance costs were limited to a percentage of your income based on what's called the benchmark plan. That's the second lowest cost silver plan in your area. If your income was around 100% of the federal poverty level, the maximum you'd pay toward health care was about 2% of your income. And in practice, many people paid zero. At 200%, it was about 4 to 6%. At 300%, about 6 to 8%. And at 400% of FPL and above, the cap was 8.5% of your income. And here is the critical part. There was no income cliff. If you made $80,000 or $100,000 or $150,000, the 8.5% cap still applied. The subsidy gradually became smaller as your income went up, and at a certain point, maybe $200,000 or higher, the subsidy effectively became zero because 8.5% of your income exceeded the cost of any plan. But it was a smooth, gradual phase out, no sudden drop, no penalty for earning $1 too much. Let me put numbers on this so you can see how powerful it was. A single person with an income of $58,000 a year would have paid roughly $410 a month for their benchmark plan. That's it. Even if the actual plan cost more, the subsidy covered the rest. A married couple in their early 60s with $120,000 in household income, 8.5% of that is $10,200 a year, or about $850 a month total for both spouses. Even for a couple in their 60s where unsubsidized premiums might be $2,000 or more a month, $850 was the ceiling. That system felt smooth, predictable, and accessible. And it's what made early retirement financially feasible for millions of people. Now let's talk about what changed on January 1, 2026. Here's what happened. Those enhanced subsidies expired on December 31st, 2025. Congress did not extend them. The House passed a 3-year extension in January 2026 with some bipartisan support, but as of today, it has not passed the Senate. There is still discussion happening, and it's possible something may change, but right now, as of the date of the recording of this video, the enhanced rules are gone. Now, and I want to be very, very clear about this, the ACA itself has not gone away. Subsidies still exist. You can still buy insurance through the marketplace. Premium tax credits are still available. What expired are the temporary enhancements, the expanded subsidies that removed the income cliff and made coverage dramatically more affordable for middle-income households. Without those enhancements, the system has reverted to the pre-2021 ACA rules. And that brings back one very significant thing: the subsidy cliff. Under the original ACA rules, which are now back in effect, subsidies are only available if your income falls between 100% and 400% of the federal poverty level. The moment you cross 400%, the subsidy doesn't gradually decrease. It drops to zero instantly. There is no phase out, no glide path, no tapering. $1 above the line and your entire subsidy vanishes. Let me show you what this looks like with real numbers. For a single person, 400% of FPL is approximately $60,240. At that income level, you still receive a subsidy. At $60,241, literally $1 more, you get nothing. That one extra dollar of income could cost you $8,000 to $14,000 a year in additional health care costs. Now, let me walk you through an example that will really bring this home. Take a married couple, both in their early 60s, buying insurance on the ACA marketplace. Their household income is $80,000, which puts them just under the 400% of the federal poverty level for a two-person household. At $80,000, they still qualify for subsidies. Depending on their state and the plans available, they might pay $400 to $600 a month total for a solid silver plan. Call it $6,000 to $7,200 a year. Now take that exact same couple and change their income to $85,000, just $5,000 more in income. They've now crossed the 400% threshold. Their subsidy is now zero. The full unsubsidized premium for a couple in their early 60s easily runs $1,800 to $3,000 a month depending on where they live. That's $22,000 to $36,000 a year. Same couple, same health, same plan. The only thing that changed was $5,000 in income, and their health care costs potentially increased by $15,000 to $28,000 a year. In some high-cost states, it's even more dramatic. A 63-year-old couple in West Virginia earning $85,000 a year could face premiums exceeding $43,000 a year for a gold plan. One of my viewers shared that he and his wife are paying $45,600 a year for the cheapest plan available with a 50-50 copay. These are not hypothetical numbers. This is what people are living right now. This is why this cliff is so important to understand, and this is why income planning has become the single most important skill for anyone retiring before 65. So what do you do about all of this? This is where it can get very interesting and where early retirees actually have an advantage that most people don't even realize. Remember, ACA subsidies are based on your modified adjusted gross income, your MAGI, not your net worth, not your total wealth, just the income that shows up on your tax return in any given year. And when you're retired, unlike when you were working a W-2 job, you often have significant control over that number. You're no longer receiving a fixed paycheck that you can't change. You're living off savings, investments, and various accounts. And how you draw from those accounts determines your MAGI. Here's how this works in practice. Roth IRA withdrawals, if they're qualified, do not count as income for MAGI purposes. So if you've been building Roth savings, you can pull from them for living expenses without it affecting your subsidy eligibility at all. Cash savings, money in your checking or savings account when you withdraw it, that's not income. You already paid taxes on it. So living off cash reserves generates zero reportable income. If you sell investments in a taxable brokerage account, only the gain counts as income, not the full amount you sold. And you can offset gains with losses in other positions. Contributions to a health savings account, if you have a high deductible health plan, directly reduces your MAGI. For 2026, you can contribute $4,400 for an individual or $8,750 for a family, plus an extra $1,000 catch-up if you're 55 or older. And here's something new for 2026. All bronze and catastrophic marketplace plans now qualify as high deductible health plans for HSA purposes. So if you enroll in a bronze plan, you can contribute to an HSA and lower your MAGI at the same time. Traditional IRA contributions can also lower your MAGI. So can solo 401k or SEP IRA contributions if you have any self-employment income. Let me put this all together with an example. Say you're a married couple, both 62. You have $1.5 million in investments, a mix of taxable accounts, traditional IRAs, and Roth IRAs. You also have $100,000 in cash savings. Your actual spending need is about $80,000 a year. If you pulled that entire $80,000 from a traditional IRA, your MAGI would be $80,000, and depending on your state, you might fall just under or just above that 400% cliff. You'd be in the danger zone. But instead, you pull $30,000 from cash savings, no income. You pull $25,000 from your Roth IRA, no income. And you pull $25,000 from your taxable account, of which maybe $10,000 is actual capital gains. Your MAGI is now just $10,000 from the taxable gains, plus maybe some dividends, let's say $15,000 total. Same lifestyle, same spending, but your reportable income just went from $80,000 to $15,000. And at $15,000 of MAGI, you're likely looking at a very low, possibly zero monthly premiums. That's not a loophole. That's how the law is designed. The ACA is income-based, and you're managing your income legally and intentionally. Now, one very important warning for 2026. Starting this year, there's no longer a cap on how much you have to repay if your income ends up higher than what you estimated when you enrolled. In previous years, there were repayment limits that protected you. Those are now gone. If you underestimate your income and receive too much subsidy, you will owe every dollar back at tax time. So estimate carefully and track your income throughout the year. This kind of planning is where a fee-only financial advisor who understands ACA income management can be worth every penny. At these premium levels, a few $100s in advisor fees could save you $10,000 or more. I always encourage you to find a good financial fee-only advisor. Now let's talk about your complete set of options in order. Let me walk you through every realistic option for your healthcare coverage that you have before 65 in the order I'd think through them. Option number 1, ACA Marketplace with income management. For most early retirees, this is where you start. If you can manage your MAGI to stay below 400% of the federal poverty level, the ACA still provides real, fully compliant health insurance with meaningful premium support. This requires planning and intentionality, but for many retirees, it's the most affordable long-term solution between retirement and Medicare. The question is, can you control your income? If yes, this is likely your best path. Option 2, a spouse or partner's employer plan. If your partner is still working and their employer offers health insurance, this is often the simplest and most robust solution. Employers typically subsidize 70 to 80% of the premium. Your retirement qualifies as a life event that allows you to enroll outside of open enrollment dates. If one spouse wants to retire and the other is happy to keep working, this can be ideal. But obviously, if both spouses want to retire at the same time, this option is not available. Option number 3, COBRA. Think of this as a short-term bridge, not a long-term plan. COBRA lets you keep your employer's health plan for up to 18 months after you leave. The benefit is continuity, same doctors, same network, same prescriptions. The cost is that now you pay 100% of the premium, plus a 2% administrative fee. For individuals, that typically runs $600 to $800 a month. For families, $1,500 to $2,500 or more. Here's one practical note from experience. There's often a temporary gap when COBRA is being set up. From the time you leave your employer to the time COBRA is fully processed, your insurance may appear inactive. If you see a provider during that window, you might get a denial. Don't panic. COBRA coverage is retroactive. Once the paperwork between your HR department and the insurer is finalized, those claims can be resubmitted and properly paid. It's annoying, but it does get resolved. COBRA makes the most sense when you're in the middle of active treatment. You have a very strong employer plan you want to preserve. You're leaving work mid-year and don't want to reset your deductible. Or you're within a few months of either ACA open enrollment or Medicare eligibility. In those cases, paying more for a short period reduces risk and stress. Here's a strategy that works well. Use COBRA for the remainder of the calendar year, then switch to an ACA plan during open enrollment. This avoids deductible resets and gives you time to plan your ACA income for the new year. But with the subsidy cliff back in place, I want to flag something. For people with income above 400% of FPL, COBRA may actually be competitive with unsubsidized marketplace plans. Run both sets of numbers before you decide. Option 4, part-time work with benefits. Some early retirees intentionally take lower stress or part-time positions specifically for health insurance. Schools, universities, hospitals, and some large employers offer benefits to part-time workers. This can be an excellent option if you're in what I call the slow fade, gradually stepping back rather than stopping all at once. You maintain some structure, social connection, and purpose while accessing health coverage that can beat unsubsidized ACA plans, especially between the ages of 55 and 64. Option number 5, military or federal coverage. If you qualify, these are some of the best deals available. Federal retirees with FEHB access and military retirees with TRICARE are, in my opinion, among the best positioned people for early retirement. Predictable, comprehensive coverage at a fraction of private insurance costs. If you have access to either of these systems, start here. Option number 6, health sharing ministries. These are faith-based organizations where members pool their money to share each other's medical costs. The monthly contributions are significantly lower than traditional insurance. Individual memberships can start as low as $100 to $200 a month. For someone facing a $2,000 to $3,000 a month in unsubsidized premiums, I understand the appeal. The largest and most established of these include Medicare, Samaritan Ministries, and Christian Healthcare Ministries. Some require a specific faith commitment, others are more broadly available. But I want to be very, very clear about what these are and what they are not. They are not insurance. They are not regulated by state insurance commissioners. They are not legally required to pay your medical expenses. They share costs based on guidelines, not contractual obligation. They typically have waiting periods or exclusions for pre-existing conditions. They have lifestyle requirements. Most require a statement of faith, regular church attendance, and abstinence from tobacco, and they will not cover procedures that conflict with their religious beliefs. For the right person, someone who is healthy, faith-aligned, and comfortable with the uncertainty, a health-sharing ministry can serve as a bridge to Medicare. But if you are in your late 50s or early 60s with any health complexity, a health-sharing ministry is not a substitute for comprehensive insurance. If you have a major health event, a cancer diagnosis, a cardiac episode, a serious accident, you want legal certainty that your claims will be paid. Health-sharing ministries cannot provide that. Go in with your eyes open, read every word of the member guidelines, and do not treat it as equivalent to insurance. Option 7, Medicaid. For low-income households, Medicaid is worth mentioning. In states that have expanded Medicaid, eligibility generally kicks in at around 138% of the federal poverty level. It's an important safety net, but if you're watching this channel and planning a retirement that supports your desired lifestyle, Medicaid is generally not the path you're targeting. If you're trying to figure out the most affordable way to cover health care before Medicare, here's the order I'd think through it. Step 1, do you qualify for TRICARE or FEHB? If yes, start there. These are the gold standard. Step 2, can you manage your income to stay below 400% of the federal poverty level? If yes, the ACA marketplace with subsidies is likely your most affordable long-term option. This is where intentional income planning becomes your superpower. Step 3, do you or your spouse have access to an employer plan? If yes, compare the costs. An employer plan, especially with employer subsidies, can sometimes beat even a subsidized ACA plan and often comes with a stronger provider network. Step 4, if none of those work, compare COBRA, unsubsidized ACA plans, and alternative options like health sharing ministries. This is where you weigh cost against coverage quality, provider access, and how long you need to bridge to Medicare. The shorter your bridge to Medicare, the more COBRA makes sense. The longer your runway, the more important it is to get into a sustainable, affordable plan, which for most people means managing income and using the ACA. Now let's talk about the bigger picture. Healthcare before 65 is not just a healthcare decision. It's a financial planning decision, an income management decision, and a retirement timing decision, all wrapped up into one. The people who navigate this well are not necessarily the people with the most money. They're the people who plan the farthest ahead with the best information and understand how the pieces fit together. If you're 3 to 5 years from retirement, now is the time to start building cash reserves and Roth balances, income sources that won't show up on your tax return when you need to manage your MAGI. Talk to a fee-only financial advisor who specifically understands ACA planning. Run the numbers for your state, your age, and your income. If you're already retired and getting hit with these increases, don't panic. But don't ignore it either. Look at whether restructuring where your income comes from could bring you below the subsidy cliff. Check whether your state has implemented supplemental subsidies. A handful have. Consider whether a bronze high deductible plan paired with an HSA could lower your costs while still giving you catastrophic protection. And if you're sitting in a job you've outgrown, afraid to leave because of losing health insurance, I see you. That fear is valid, but there are paths through this. They require planning and some creativity, but they do exist. Don't let health insurance be the only reason you stay somewhere that's no longer serving you. Healthcare falls right into my prosperity pillar. It's one of the 3 pillars of retirement readiness, along with purpose and play. If you want to see where you stand across all 3 pillars, take my free Retirement Readiness Scorecard quiz. The link is in the description. It takes 5 minutes and it'll show you exactly which areas are strong and which need attention before you make your move. And if you want help working through your specific situation one-on-one, whether it's healthcare planning, income strategy, or designing your overall retirement, I offer retirement design consultations. 60 minutes, just you and me, working through your particular circumstances. That link is in the description as well. I post new videos every week. If you got anything out of this one, please give it a like. If you're new here, consider subscribing. And if you know someone who's wrestling with this exact question, how to afford health care before 65, please share this video with them. It might be exactly what they need right now. I'll see you in the next one.